Ever found yourself in the dentist chair, waiting for that numbing shot and just wondering, how long is my face going to feel this weird? Well, today, we're getting into it. You know that exact moment, right? You're leaned all the way back, there's a super bright light in your eyes, and you're about to get a filling or some other work done. And the one thing you're probably thinking about, besides the sound of the drill, is that numbing injection. How does it even work? And more importantly, when can I feel my face again?
So that shot, a lot of us just call it Novocaine. That's actually the brand name for a drug called Procaine. It's what's known as a local anesthetic. And all that means is that it numbs a very specific targeted spot without knocking you out completely. It's absolutely perfect for things like filling a cavity, getting a mole removed, or even some types of eye surgery.
And get this, Novocaine has a really interesting backstory. It was a total game changer when it was created way back in 1905. Why? Because before that, the go-to anesthetic was actually cocaine. Yeah, so Novocaine was the first big synthetic alternative, which was a huge, huge leap forward for medicine.
So how does this stuff even work? Well, it's actually pretty simple when you break it down. When the dentist injects it, the Novocaine goes to work on the nerves right in that area. It basically puts up a roadblock, you know? It physically stops those nerves from sending any pain signals up to your brain. So while all the work is happening, your brain is just chilling, completely unaware of any pain. Pretty cool, right?
Okay, so that brings us to the real question, the one you're probably here for. Once that numbness finally kicks in, how long is it actually going to stick around? Let's break down the timing.
The great news is, you're not going to be waiting around forever. It gets to work pretty fast. After the injection, you'll start to feel that classic numb, tingly sensation spread through the area in just about 5 to 10 minutes. That's how you know it's kicking in and getting ready to do its job.
But here's something you might not know. If a dentist were to use Novocaine all by itself, it's actually the shortest acting anesthetic shot out there. The numbness would only last for about 30 to 60 minutes. Now that might be okay for a super quick filling, but for most procedures, that's kind of cutting it close.
So how do they get around that? Well, they add a little something extra. Novocaine is almost always mixed with epinephrine, which you probably know is adrenaline. Adding that one simple ingredient makes the blood vessels in the area tighten up. This keeps the anesthetic right where it needs to be for longer, stretching that numbing effect to about 90 minutes. So for a typical appointment, you can plan on being numb for about an hour and a half.
Of course, that 90 minutes, it's really just a ballpark number. The actual time can change based on the dose you get, what kind of procedure you're having, and even just how fast your own body's metabolism works. There's also a very rare genetic condition that affects about 1 in every 5,000 people. It makes it way harder for their bodies to break down the drug, so for them, the numbness can last for hours and hours.
Okay, so we're talking about injections and drugs, which naturally leads to the next question. Is this stuff safe? And the short answer is yes, Novocaine is considered very, very safe. Doctors and dentists are experts at figuring out the exact dose needed for any given procedure, which really minimizes any potential risks.
And for most people, any side effects are super mild and don't last long at all. As the drug starts to wear off, you might feel some tingling, kind of like pins and needles. Some people might get a little headache, feel a bit dizzy or sleepy, or have some minor soreness right where they got the shot. All of that stuff typically goes away really fast.
But what about the scary stuff, like allergic reactions? Well, while it's technically possible, it's so important to know that true allergic reactions are, and this is a direct quote from the research, exceedingly rare. Your medical team is always ready for that possibility, but honestly, it's not something most people will ever have to worry about.
So, all this might have you thinking, if Novocaine is so safe and it works so well, why don't we hear about it as much these days? Why would your dentist maybe pick something else?
Well, the answer is actually really simple. We've just developed newer drugs that last longer. For instance, a super common alternative today is lidocaine. When you mix that with epinephrine, the numbing can last up to 2 hours. That extra 30 minutes gives dentists a much more comfortable window to finish their work without having to worry about the numbness wearing off too soon.
So, what's the big takeaway here? Novocaine was an absolutely revolutionary drug that changed medicine, but today, it's just one of many safe and effective options your dentist has. And the most important thing to remember is you can always ask. If you're ever curious or worried, your doctor or dentist is the best person to tell you exactly what they're using and why. It's always okay to start that conversation.